They feel misunderstood. They become self-absorbed in certain activities, indeed self-absorbed in thoughts.
Dr. O'Sullivan, what are the major signs of, deep loneliness, problematic loneliness?
There are three areas in the person's life that are affected, that go downhill, if I can put it that way. Social, psychological, and physical. Social changes include less and less contact with family, friends, perhaps old workmates, social acquaintances. They see these people less and less, and eventually they have little contact with them as they become persistently socially isolated. That social withdrawal leaves them self-absorbed and rejected, a sense of being rejected and overlooked by other people. Psychologically, they're unhappy, perhaps depressed. They may be not clinically depressed, but depressed nonetheless. They feel misunderstood. They become self-absorbed in certain activities, indeed self-absorbed in thoughts. They may become involved in social media, and that increases their sense of isolation, and it becomes a substitute for social activities. Physically, there's a decline in the interest that they have in looking after themselves. They become neglectful of appearance, or self-care, diet, exercise, all the things that we take notice of, take an interest in our everyday lives to maintain a reasonable standard of living. These are neglected, they decline, and they gradually slip into chronic ill health, aches and pains, recurring infections, and then over time, as the years go by, they develop more serious physical illnesses that have a major impact on their health. And this description I've given is an indication of how serious a problem loneliness is, how much of a disability it is, and how it affects every aspect of the person's life.
So when it comes to finding solutions for loneliness, practically speaking, what types of solutions could a person use?
When we're thinking of solutions, we must think of the cause. Why has the person become socially isolated in the first place? Because that will determine how we go about providing help to this person. Is this a lifelong condition? Has the lonely person been lonely all their lives, or is it something that has followed an adverse event? If it's a lifelong condition, we're looking at personality factors, temperament, lack of social skills, perhaps chronic mild depression and things like that need to be addressed. If it's something that followed an adverse event, we're looking at a person who has experienced loss, painful loss. And very often, the first painful loss is followed by further losses as they unsuccessfully attempt to adjust or adapt to the first major loss. So, having looked at the possible causes, we then try to devise a plan. How do we best help this person? Well, the first question is, what are their immediate needs? Do they require immediate practical support? Do they need help in terms of their life circumstances, financial help, accommodation and things like that? Then we look at providing one-to-one support, regular visiting, regular telephone contact, or perhaps counselling, or coaching regarding social skills training, problem-solving training. The next step in the plan perhaps would be to connect them to the community, or to family if that's possible, to social supports like groups, recreational centre, mental health support groups. And finally, to assess how they're doing physically in terms of their medical needs and psychologically in terms of their mental health needs. So this is a plan that one could follow step by step in terms of how we approach a person with a serious social isolation or a serious loneliness problem.
And how do people in the person's life, how can they go about helping? How do we help someone that we care about who is lonely?
I think that how we go about it is best put this way, this short phrase: we do it sensitively. We, first of all, have to make sure that the lonely person is looking for help. We must not go uninvited into the private life of someone else. We must be respectful of the choices that they have made over the years, choices that we may not agree with or indeed disapprove of. Nonetheless, choices that they have made, and we must be respectful of these. We must try to become aware of what they think is important for them. How can they best be helped from their perspective, from their point of view? We must, in our interactions with them, we must be respectful and sensitive and regain their sense of trust, because very often the lonely person has had years of experience of rejection, neglect, isolation. And part of our task in helping them is to establish a trusting relationship with them.
Thank you.